Welcome to Module 2 of Human Diversity in Healthcare. We're going to talk about the terms vulnerability and marginalization as it pertains to the United States. We're going to define discrimination and identify groups who are at risk, as well as describe terms such as cultural bias, fears, stereotypes, and then discuss how these affect perceptions and interactions with others. And then last, to articulate the impact of discrimination. If we begin with the term vulnerability, we know that vulnerable populations are groups that are not well integrated into the healthcare system. And that's usually because of their ethnic origin, different cultural practices than our own, economic status, such as low socioeconomic status, geographic location, whether out in the suburbs and rural areas, or because of health characteristics. Unfortunately, this isolation puts these individuals at risk for not being able to obtain the necessary medical treatment. So when you see them, they are much sicker and they have poorer health outcomes. The term marginalization is a bit different, and that's a social process. And we talk about it as if you think about it, a sheet of paper. The margins of the paper are the outer limits or the edges of the paper. So if we say that marginalization is a social process of becoming or being made marginal, so confined or being pushed to the outskirts of society. The individual is forced into basically a new system of rules while facing some social stigma, maybe stereotypes from whoever is the dominant group in society. So when we talk about being marginalized, many years ago, before modern healthcare, if someone had leprosy, leprosy is highly contagious. It's where a disease eats away parts of the body, and the way that they handled that was they isolated these people by pushing them to the outskirts of society. They were removed from villages and basically left out to die. That's an example. I know it's a bit extreme, but it is a good example of what marginalization is. Vulnerable marginalized groups frequently include the following: those in racial or ethnic minorities, the low income, both children and adolescents, as well as the elderly, those who are homeless, those who are chronically ill. Then think of, those are a lot of vulnerable groups, but think of some people who are marginalized. So how about those who are addicted to drugs? How about those where here it says those who have HIV? That's definitely a chronic condition that we have stereotyped over many years and we have pushed to the margins of our society. And why is it important for us to study these groups? Generally speaking, as we said previously, there are poor health outcomes for these populations, and we have an ethical obligation to care for all individuals, no matter what their race, ethnicity, socioeconomic status. But also, there are common traits that are present for different populations. And so here's an example. So those who are in a racial or ethnic minority group are much more susceptible to being low income. We also know that those who are low income have a higher risk of becoming homeless. And then the list goes on. They're also frequently plagued with chronic conditions. So when they come into the hospital, they have multiple risk factors. When we talk about the dominant culture, we previously had said that we're moving towards a multicultural society. In a multicultural society, all cultures are celebrated and respected equally. But we just got done talking about a dominant culture, and that can be promoted with deliberation and by basically suppressing other groups. So other cultures, maybe other subcultures within a bigger culture. And a dominant culture is the standard or the norm for a society as a whole. The dominant culture is usually, but it's not always, the majority, and it does achieve its dominance by, here's the key words, controlling social institutions. For example, communication, educational institutions, artistic expression, law, political process, business. And when a dominant culture has control of those types of institutions, so the social institutions, they have control of persuasion, perceptions. Just think of the control and the power that media has on society. And that includes electronic media like social media. So cultural biases, judgments involve a prejudice in viewpoints. In the module, there is an opportunity for you to take a bias test. And this is a well-known, it's called the implicit bias test. It's well-known in educational institutions. It is a psychological analysis through a testing process that can equate the way you react to different pictures and words with possible or the potential for bias. When we talk about racism, we're talking about a bias against different races. So their attitudes, actions, or even institutional practices that marginalize other individuals, and that's considered discriminatory. Racism, in particular, has historic roots in beliefs in one group being more superior than another, or one group being more inferior than another. And although these beliefs are now widely rejected as a society, we also know that discrimination still continues to exist. And we've talked about racial discrimination, but we also need to be aware that discrimination exists in many more instances than just racial bias. So some other forms are sexism, ageism, homophobia, anti-Semitism, and religious intolerance, xenophobia, which is a fear or hatred of foreigners or foreign countries. We also know that discrimination really it tends to be a lack of knowledge of different groups. They're based on assumptions or perceptions that tend to be false. It may be that you're different or they're different and you don't understand differences. So you think of a young child who's growing up that may not be exposed to different cultural practices, beliefs, and so they may have different perceptions of other children who are different than they are. They may not be considered discriminatory towards the other children, but they don't have a knowledge base. So as an individual grows and matures, they have the opportunity to make decisions for themselves. But sometimes it's not just based on knowledge, it's based on prior behaviors and experiences. So because many people fear what seems strange or unknown, they react with suspicion or even violence to anyone whose appearance, culture, or behavior is unfamiliar. And unfortunately, some of those experiences lead to lifelong implications. Some of the different groups who are discriminated against are listed here. And again, I'm sure you're well aware of who these individuals are, both in and outside of the healthcare system. A brief poem here. Very common in a school setting where a young person feels that they're being isolated. They're trying to develop their own self-concept, determine who they are, and they may stand out. They may choose to dress different than the mainstream. And it just talks about how someone feels when they're being discriminated against. As we stated previously, we know that it can lead to disparities in healthcare, in education, employment, access to services, housing, wages. There's also some physiological effects when someone's being discriminated against, such as increased blood pressure, stress, decrease in your well-being, poor coping skills, risk of addiction. We also know that discrimination at the institutional level affects the health of vulnerable and marginalized populations. Think of healthcare providers who often have perceptions of what to expect with different populations, And at times, those perceptions may be wrong. Just because someone fits into a racial or ethnic group doesn't mean that they always use the same cultural values or beliefs as that population. Now it's time to view the video, The Angry Eye. The Angry Eye video is part of your discussion for the week, and the purpose of the assignment is to help you understand what it feels like to be a part of a vulnerable group and consider the effects of discrimination. Jane Elliott, who was a pioneer in racism awareness training, was first inspired to action by the assassination of Dr. Martin Luther King in 1968. As a third-grade teacher in an all-white, all-Christian community, she struggled for ways to help her students understand racism and discrimination. She had adopted the blue-eyed, brown-eyed exercise, which you're going to see in the video, in which participants are treated as inferior or superior based solely on their eye colors. And that's as a result of reading about the techniques that the Nazis used on those they designated undesirable during what is known as the Holocaust. So take a moment and view the video, write down your thoughts, and that'll help you as you complete your Angry Eye discussion.